Name of this view: A. Spider view, B. RIO-caudal view, C. Epicranial view, D. LAO-cranial view. Correct answer A. Spider view. It is LAO-caudal view, otherwise known as spider view, often the first view to be taken during coronary angiography. It is called the spider view because of its resemblance to the legs of a spider. The view is useful in identifying disease of left main and its proximal branches. LMCA, left main coronary artery; LAD, left anterior descending coronary artery; LCX, left circumflex; OM, obtuse marginal. Angio movie showing the left coronary angiogram in LAO-caudal view. The branches have been marked in the still image as mentioned in the previous image. JL, Judkins left coronary catheter. The dye reflects into the aorta indicates that there is no wedging of the catheter in the left main. Which coronary artery is this? A. Right coronary artery, B. Left circumflex coronary artery, C. Left anterior descending coronary artery, D. Obtuse marginal coronary artery. Correct answer A. Right coronary artery. Right ventricular branch has been marked. Crux is the junction of atrioventricular and interventricular grooves posteriorly. RCA divides into posterior descending coronary artery and posterior left ventricular branches at the crux. This is dominant right coronary artery as it crosses the crux. In which view was this RCA imaged? A. RIO view, B. LAO view, C. Lateral view, D. None of the above. Correct answer A. Right anterior oblique RIO view. Right anterior oblique view shows the proximal part of the right coronary artery in an almost vertical line. RIO view is identified with the spine seen on the right side marked by yellow arrows. Several septal branches arising from the PDA can be seen well in this view. In fact, the identification of PDA in a coronary angiogram is by the septal branches which arise from it. Which is the vessel marked by the arrow? A. Left main coronary artery, B. Left circumflex coronary artery, C. Left internal mammary artery, D. Obtuse marginal. Correct answer C. Left internal mammary artery, Lima. Lima is usually anastomosed to the LAD, left anterior descending coronary artery, as in this case. Good distal flow to the LAD from the Lima is seen. Retrograde flow into the LAD proximal to the anastomosis is also seen. Here the Lima graft is imaged in the lateral view. The image has been darkened a bit by post-processing to visualize the Lima and LAD well. Since it was an injection into the left subclavian artery just near the Lima ostium, the contrast density was a bit lower than that of a superselective Lima injection. The sternal wires indicate the post-sternotomy status. The vessel marked by yellow arrow is A. Left anterior descending coronary artery, B. Left internal mammary artery, C. Saphenous vein graft, D. Left circumflex coronary artery. Correct answer C. Saphenous vein graft, SVG. The proximal end is connected to the ascending aorta and distal end to the obtuse marginal branch of left circumflex coronary artery, OM in this case. Coronary angiogram in a post-coronary artery bypass person showing saphenous vein graft to obtuse marginal branch of left circumflex coronary artery. Sternal wires indicate the post-CABG status. Catheter tip can be seen engaged in the ostium of saphenous vein graft in the ascending aorta. Part of the catheter in the descending aorta is also visible as it is a transfemoral coronary angiogram. This view is called A. Leo phase of coronary angiogram, B. Spider view, C. Hepatoclavicular view, D. None of the above. Correct answer A. Leo phase of coronary angiogram. It is a delayed image after injection of contrast into the left coronary artery. Venous phase is seen with coronary sinus and its tributaries. Assessment of tributaries of coronary sinus is important during cardiac resynchronization therapy for implantation of left ventricular lead. The vein seen in the middle of the image is the middle cardiac vein, and that in the left cardiac border the posterolateral vein. A small inconspicuous vein seen behind the coronary sinus label is the small cardiac vein. Pulsus parvus et tardus is seen in A. Aortic regurgitation, B. Mitral regurgitation, C. Tricuspid stenosis, D. Aortic stenosis. Correct answer D. Aortic stenosis. Pulsus parvus et tardus is a slow rising, low volume pulse in aortic stenosis. It corresponds with the long, late peaking systolic murmur, which also indicates severe aortic stenosis. Syncope as a symptom is most likely in A. Tricuspid stenosis, B. Tricuspid regurgitation, C. Mitral regurgitation, D. Aortic stenosis. Correct answer D. Aortic stenosis. Syncope is an important symptom of severe aortic stenosis and usually occurs with exercise. As the cardiac output is nearly fixed in severe aortic stenosis, exercise-induced peripheral vasodilatation reduces the systemic blood pressure and cerebral perfusion. Sudden increase in left ventricular systolic pressure in response to severe exertion can also induce ventricular fibrillation and sudden death in severe aortic stenosis. Angina as a symptom is most likely in A. Pulmonary stenosis, B. Mitral stenosis, C. Tricuspid stenosis, D. Aortic stenosis. Correct answer A. Aortic stenosis. Angina in severe aortic stenosis is due to demand-supply mismatch as the left ventricle is grossly hypertrophied. Angina can sometimes occur in severe mitral stenosis with severe pulmonary hypertension due to right ventricular pressure overload. Angina in aortic regurgitation is usually nocturnal, while that in aortic stenosis is during exertion. Paroxysmal nocturnal dyspnea is a symptom of A. Left heart failure, B. Right heart failure, C. Pulmonary embolism, D. None of the above. Correct answer A. Left heart failure. Common causes of paroxysmal nocturnal dyspnea are severe mitral stenosis and left ventricular failure. Please note that in mitral stenosis, there is no left ventricular failure, but left atrial pressure is elevated, causing pulmonary congestion. Dyspnea in valvular heart disease usually denotes A. Elevated left atrial pressure, B. Elevated left ventricular systolic pressure, C. Elevated right atrial pressure, D. Elevated right ventricular diastolic pressure. Correct answer A. Elevated left atrial pressure. Elevated left atrial pressure leads to elevated pulmonary venous pressure and consequently pulmonary congestion, leading to formation of fluid in the pulmonary interstitium and alveoli, pulmonary edema, leading to dyspnea. Long-standing persistent atrial fibrillation is defined as A. AF lasting more than 10 years, B. AF lasting more than 5 years, C. AF lasting more than 2 years, D. AF lasting more than 1 year. Correct answer D. AF lasting more than 1 year. If cardioversion or catheter ablation attempts have failed or are not being considered, then it qualifies for the designation of permanent AF. If conversion is being considered, by definition, the designation changes back to long-standing persistent AF. True statement regarding risk of stroke in non-valvular versus rheumatic valvular atrial fibrillation. A. Risk of stroke in rheumatic valvular AF is 17 times higher than age-matched controls. B. 5-fold increase in risk of stroke with valvular AF. C. Risk of stroke is higher with rheumatic valvular AF. D. All of the above. Correct answer D. All of the above. Risks of atrial fibrillation include A. Precipitation of heart failure, B. Stroke, C. Poor quality of life due to lowered cardiac output, D. All of the above. Correct answer D. All of the above. Atrial fibrillation reduces cardiac output, especially in those with reduced left ventricular compliance, as the role of atrial contraction in ventricular fibrillation is more important in them. Thromboembolic stroke is one of the most dreaded complications of atrial fibrillation. Type of LVH in mitral regurgitation is A. Eccentric hypertrophy, B. Concentric hypertrophy, C. Asymmetric hypertrophy, D. None of the above. Correct answer A. Eccentric hypertrophy. Eccentric hypertrophy is dilatation of left ventricular cavity with thickening of the wall and occurs in regurgitant lesions like mitral regurgitation and aortic regurgitation. Concentric hypertrophy is without dilatation of cavity as occurs in stenotic lesions, aortic stenosis, coarctation of aorta, and hypertension. Asymmetric hypertrophy of septum is characteristic of hypertrophic obstructive cardiomyopathy. Most common congenital heart disease in adults, excluding bicuspid aortic valve: A. Atrial septal defect, B. Ventricular septal defect, C. Patent ductus arteriosus, D. Tetralogy of Fallot. Correct answer A. Atrial septal defect. Most common congenital heart disease at birth is ventricular septal defect. Tetralogy of Fallot is the most common cyanotic congenital heart disease in the adult. Wrong statement about chlorogenic acid. A. An ingredient of coffee. B. An antioxidant. C. Contains no chlorine. D. Improves glucose metabolism and insulin sensitivity. E. None of the above. Correct answer E. None of the above. Antioxidants in coffee like chlorogenic acid have been found to improve glucose metabolism and insulin sensitivity. Chlorogenic acid gets the name from the green color produced when oxidized. Drug used for coating coronary stents to reduce restenosis: A. Atorvastatin, B. Aspirin, C. Sirolimus, D. Clopidogrel. Correct answer C. Sirolimus. Sirolimus is an anti-malignant drug which is used in drug-eluting stents, which reduces neointimal proliferation, the important cause of in-stent restenosis after coronary angioplasty with stenting. A person with chronic kidney disease is more likely to die of A. Coronary artery disease, B. Progressive renal failure, C. Hepatic failure, D. None of the above. Correct answer A. Coronary artery disease. Chronic kidney disease is an important risk factor for coronary artery disease, and a person with chronic kidney disease is more likely to have a coronary mortality rather than die of progressive renal failure. The time taken for risk of developing coronary artery disease to approach that of non-smokers after smoking cessation: A. Soon after cessation, B. 1 year, C. 3 to 5 years, D. None of the above. Correct answer C. 3 to 5 years. The coronary risk comes down by 51% 1 year after smoking cessation. The risk for developing coronary artery disease approaches that of non-smokers 3 to 5 years after smoking cessation. But the risk for developing chronic obstructive airways disease and bronchogenic carcinoma may persist for even a decade after smoking cessation. Pick up the false statement about angina pectoris. A. Chest pain occurring at rest is unlikely to be angina. B. Postprandial chest pain can mean multivessel coronary artery disease. C. Anginal pain seldom radiates above the jaw or below the umbilicus. D. An important symptom of severe aortic stenosis. Correct answer A. Chest pain occurring at rest is unlikely to be angina. Rest angina indicates a more severe form of angina known as unstable angina. In postprandial state, myocardial oxygen demand is increased as cardiac output increases to meet the enhanced splanchnic flow. Severe aortic stenosis can cause angina as there is a mismatch between the coronary blood supply and the myocardial oxygen demand, which is increased due to left ventricular hypertrophy. Causative agent of rheumatic fever: A. Group A beta hemolytic streptococci, B. Group A alpha hemolytic streptococci, C. Streptococcus viridans, D. None of the above. Correct answer A. Group A beta hemolytic streptococci. Rheumatic fever is a delayed manifestation occurring weeks after throat infection with Group A beta hemolytic streptococci. It does not occur after streptococcal skin infection, which can cause glomerulonephritis. Rheumatic fever is an immune complex mediated post-streptococcal disease. Beta blocker with additional vasodilatory effect. A. Atenolol, B. Metoprolol, C. Carvedilol, D. None of the above. Correct answer C. Carvedilol. Carvedilol has additional vasodilatory effect and hence one of the best beta blockers found to be useful in heart failure. In stable heart failure, beta blockers have been shown to improve long-term survival. But beta blockers should not be started in decompensated heart failure. They should be started only after initial stabilization, that too in small doses which are gradually titrated upwards. Paradoxical splitting of second heart sound can occur in all of the following except A. Mitral regurgitation, B. Left bundle branch block, C. Severe aortic stenosis, D. Right ventricular pacing. Correct answer A. Mitral regurgitation. In mitral regurgitation, since the left ventricle has two ways of emptying, aortic outflow and mitral leak, aortic component of second heart sound occurs early and there is wide splitting. In all other conditions, the aortic component of second heart sound is delayed and paradoxical expiratory splitting of second heart sound can occur. Elderly hypertensive gentleman with ST segment elevation in inferior leads and a new aortic regurgitation. Choose the best option. A. Acute inferior wall myocardial infarction, B. Proximal dissection of aorta, C. Aortic wall perforation due to endocarditis, D. None of the above. Correct answer B. Proximal dissection of aorta. In proximal dissection of aorta, the aortic wall can become incompetent. Right coronary artery is more often involved in aortic dissection, causing concomitant inferior wall myocardial infarction. Which of the following is an ECG finding of hyperkalemia? A. QT interval prolongation, B. Prominent U wave, C. T wave inversion, D. Tall tended T waves. Correct answer D. Tall tended T waves. Symmetrical tall peak T waves are characteristic of hyperkalemia. Prominent U waves are seen in hypokalemia. Apparent QT interval prolongation occurs in hypokalemia due to flattening of T waves with appearance of prominent U waves. The effect of angiotensin II on erythropoietin production is A. Increase, B. Decrease, C. No effect, D. Bimodal. Correct answer A. Increase. This is due to decreased renal blood flow. Inhibition of the renin-angiotensin system with ACE inhibitors or ARBs can decrease erythropoietin secretion and cause anemia. Normal clinic blood pressure with elevated ambulatory BP is called A. White coat hypertension, B. Masked hypertension, C. Resistant hypertension, D. Postural hypertension. Correct answer B. Masked hypertension. The reverse is seen in white coat hypertension. Masked hypertension can be suspected with higher values being recorded from home measurements. Masked hypertension has an adverse cardiovascular impact. Non-dippers are those persons whose blood pressure at night does not dip % below daytime blood pressure. A. 10%, B. 15%, C. 20%, D. 25%. Correct answer A. 10%. Non-dippers have a higher risk of stroke. The diurnal variation in blood pressure is recorded by ambulatory BP monitoring. True about tolvaptan. A. ADH antagonist, B. Rifampicin can decrease its efficacy, C. Cyclosporin can increase its effect, D. All of the above. Correct answer D. All of the above. Effects of rifampicin and cyclosporin are because of the influence on tolvaptan metabolism by the CYP3A pathway. Antidiuretic hormone is an A. Octapeptide, B. Decapeptide, C. Pentapeptide, D. None of the above. Correct answer A. Octapeptide. The central effects of ADH are mediated by V1A and B receptors and the peripheral effects by V2. Which of the following is not a major manifestation of rheumatic fever? A. Carditis, B. Chorea, C. Polyarthritis, D. Prolonged PR interval. Correct answer D. Prolonged PR interval. Prolonged PR interval is not considered to be an evidence of carditis and hence not a major manifestation. Which of the following are more common in females than in males? A. Primary pulmonary hypertension, B. Patent ductus arteriosus, C. Secondum atrial septal defect, D. All of the above. Correct answer D. All of the above. 65 to 75% secondum ASTs occur in females, while the gender distribution is equal for sinus venosus and ostium primum ASTs. Primary pulmonary hypertension is twice as common in females than males. Patent ductus arteriosus is twice as common in girls than boys. Drug which can shorten QT interval in LQT3. A. Amiodarone, B. Quinidine, C. Procainamide, D. Mexiletine. Correct answer D. Mexiletine. In LQT3, there is excessive inward sodium current which is blocked by mexiletine, but this effect may not be seen in all cases of LQT3. Most common cause of death in older women. A. Uterine malignancy, B. Carcinoma breast, C. Cardiovascular disease, D. None of the above. Correct answer C. Cardiovascular disease. T-wave inversion in anterior chest leads in young females is most likely due to A. Acute myocardial infarction, B. Acute pulmonary embolism, C. Persistence of juvenile pattern, D. None of the above. Correct answer C. Persistence of juvenile pattern. Juvenile pattern is the inversion of T-waves in anterior chest leads seen in children and can persist in young adulthood in females. It becomes normalized earlier in males.